Dr. Luke Barr. I'm one of the co-founders at SensIQ. I'm also the chief medical officer. And today we're going to talk about a little bit of the changing landscape that we've been seeing kind of, take shape and really what we anticipate to be manifesting in the year 2026. So let's take a look at the next slide as well, and then we'll kind of be right into it. So a couple of the major things that we're seeing is how the care needs for people are changing. And, this is becoming a larger and more complex and more dynamic field day by day, but you can extract themes from experience. And one of the major things that we're seeing is a constant kind of struggle along three major vectors. One is as the population ages, even the younger population, we are seeing a transition that is a lot of times hormonal, whether that's for women going through menopause or going, through pregnancy or recovering from pregnancy, or a lot of men who for many years have been, feeling like they're not quite at the top of their game and are going through something that's more and more commonly recognized as andropause. So there's both, there's sex hormone changes both for men and women that are becoming major players in the field and a major driver of care needs. At the same time, our society is much more distracted and we're constantly bombarded by more and more different forms of stimulation, both at work and at home. So it's become very, very difficult to maintain our focus and to maintain our cognitive function when we are constantly being pulled in lots of directions. And then on top of that, as a major third driver, we're seeing a lot of under recovery. So not just sleep deprivation and poor nutrition, not having enough nutritional needs, but also when we see people attempting to recover and trying to rest, we're under recovering, and that is leaving the body in a state that's kind of chronically depleted, both from an energy perspective, a metabolic perspective, as well as a cognitive perspective. So that's sort of the three major themes that we keep hearing through 2025 and seem to be becoming more and more pronounced as we go into 2026. And a huge part of this population is now looking online for these kinds of hacks, quote unquote hacks, that are supposed to be sort of quick fixes and habit changes that are going to allow them to kind of overcome some of these challenges. But oftentimes we're only seeing very, very short-term changes that don't get the long-term benefits that people really need. So let's take a look at the next slide and see what else we're going. So as we kind of just talked about in the previous slide, this is what we've been hearing from a lot of our practitioners nationwide and even around the world. And these are highlighting some of those additional kinds of problems and going into them a little bit more granularly. So again, we talked about under recovery. Poor sleep quality is a major component of that. And sleep quality has a number of different components that can interfere with the quality of sleep and a lot of different parameters. But one of the major things we're seeing, especially over the past few years and really becoming, trending towards a major thing, is this idea of circadian rhythm dysregulation, circadian rhythm misalignment. And a lot of that seems to be linked to a number of issues, but one major one seems to be kind of excessive melatonin use. And that seems to be causing a hormonal disruption and causing circadian dysregulation from overuse and overdosage of melatonin. Again, going back to these kind of online hacks. That, in addition, is also going to cause people to be groggy when they wake up. So again, that circadian dysregulation is significantly going to affect the quality of sleep as well. And then again, looking at the stress, the excessive cortisol, that's going to promote wakefulness, and that is also going to cause poor sleep. So even though somebody may be saying, I'm sleeping more than ever, why don't I feel refreshed? These are some of the major drivers of that non-refreshing sleep, even though the length of sleep is, should be adequate. They're still not recovering, which means that sleep is not doing what the body needs it to do to help the body recover from the rigors of the previous day or days. Dovetailing with that, we're seeing a lot of brain fog becoming a major, major driver of patient complaints. And awareness of this seems to be really kind of coming to a head and becoming a major driver of visits, both something that I see very frequently, in acute practice, people coming to the emergency room and being activated as strokes or other things. And also just kind of complaints, hey, doc, I know I'm in here for X, Y, and Z, but I'm also noticing this, what can you do for that? So brain fog is becoming a very, very recognized issue with the very, very high-paced, hectic lives and distracted lives that many of us are living. And this comes down to a number of different things. But many people are really, really looking for a solution to their brain fog that's not stimulant-based, because they're constantly feeling wired. And now we're starting to see a lot more of the data showing that those constant stimulant loops can has a lot of long-term side effects, and also not really creating the benefits that people want. In addition, burnout is being more recognized, not just among the classically seen kind of professions like people in our first responders, police, firemen, but also, and doctors is a kind of classic one as well, but also day-to-day burnout from more quote unquote, sort of mundane jobs, whether that's just, being a stay-at-home parent, or having a regular sort of sales job, or a more sort of, less commonly seen as a real burnout, high stress job. People are still feeling this burnout, and they're noticing that decline in their cognitive function. So people are noticing that this is affecting their ability to focus, their ability to make decisions accurately, and also how they interact with other people. And that can cause problems both at home and in the workplace. And oftentimes this leads to misdiagnosis, it leads to frustration, and people feel like they're not being heard, and they want something that's simple, but also that's something that's going to streamline their daily routine and allow them to keep at it over a long-term, a little something going on there, something that they can keep at in the long term, so that they are able to maintain those benefits and continue to feel better. They don't want something that's just going to last a week or a month, and then the benefits are no longer there. So let's take a look at our next slide. And again, if there's any questions about this, guys, throw them into the chat or write them down, save them for later. We'll have plenty of times to kind of discuss all of these as we go forward in the talk. So all of this being put together, it seems that if we want to have a successful practice where we're, being impactful with our patients, we have to look at simple, maintainable over the long term, and synergistic solutions that are not only data driven, but are also going to target the specific needs of each individual. So when it comes to looking at someone's overall health, we have to remember that the brain is a highly integrated system, and that integrates with our nervous system, and that's going to have profound impacts on our overall performance capacity, as well as our capability to recover and adapt to new challenges. Next slide, please. So what are some of the kind of things that we need to look at if we want to have a successful strategy developed for any particular patient that may come to us seeking assistance? One of the major trends that we're seeing, again, going back to these hacks, is people seem to be tired of these, 5-hour morning routines and taking 50 million different supplements just to get ready for work. That major bloated, kind of overdone, super stacks is really sort of going by the wayside, and people really want something that's going to be much more streamlined. And it seems in order to do that, we want to focus on a few major things. One, we want to look at the cellular metabolism. So we want to make sure that energy production is maximized for the nutritional components that people are taking in. Another major one is neuroinflammation. We're starting to recognize that neuroinflammation, even on a very minute degree, can start to have profound effects on our cognition on a daily basis. And that can, goes back to kind of, gut-brain interact. It goes back to things like poor sleep, getting into lymphatic. We're going to talk about all of this as the talk goes on. Circadian rhythm, another major one. People want to feel like they're getting back into sync. People feel like they've been pulled out of sync. One, from overstimulation. Two, from high distraction, high stress, high cortisol. And another major factor is the constant utilization of blue light causing disruption in our sleep onset, delaying that sleep onset. So aligning circadian rhythm is going to be a crux of a number of these protocols. And then a major one is going to be our neurotransmitter balance, so that our mood, cognition, attention, focus are all aligned and are able to be maintained in a healthy fashion over the long term. Let's take a look at the next slide, please. Excellent. So, here are a couple of examples of protocols that we can look at. And this is something that's, an evening protocol. And, it's part of our restful nights system. So this is something that looks to help provide support for stress, but also providing support for really good sleep, and not just sleep as in, I was knocked out cold for 12 hours. Because as we talked about, it's not really just the duration of sleep, and we'll get into this a little bit more later on as well, but critical is going to be the quality of sleep. So falling asleep, staying asleep, and waking up feeling refreshed are major components, and we have to look at all three of these if we want to have appropriate sleep. And a major component of that is maintaining healthy sleep architecture, and that's why, for instance, before bed, we generally want to talk about looking at something like L-theanine, because that's going to promote, it's very, very famous for promoting alpha waves, but it's also critical in stabilizing the theta waves, which are crucial and foundational to our deep, slow wave sleep. And it's during our slow wave sleep that glymphatic system is activated. And that glymphatic is what's allowing that brain to pulse with those electrical rhythms and flush out all of those metabolic waste and toxins. So absolutely critical that we really kind of think about things in a multifaceted way and not just get hung up on one component. Most people think of theanine and they think of it as an activator, but we also want to be able to think about things in a completely different dimension. And like we talked about, theanine for sleep architecture is a critical component. And again, things to help with cortisol support, calming. So reishi, great for cortisol support. Valerian root, very GABAergic, has a lot of data behind it that's showing how critical it is for activating that GABA system and really calming down the entire CNS, primarily the brain, and allowing people to feel much more relaxed. So we're starting to help someone become relaxed and then preparing them for a robust sleep, so they can actually go through all of those sleep cycles. So just a couple of different examples of how you might want to think about building out a protocol and some of the different components that you could consider including in it. Let's look at the next slide, please. Very commonly, people are talking about interactions between their memory and their mood. And this is very, very common amongst women as they're going through menopause. So, hormonal shifts can cause a lot of different things. They can cause palpitations, this feeling of anxiety, alterations in sleep, alterations in mood, and alterations in our ability to focus. And many people, as we touched on a bit earlier, was that with the stimulant side of things, the stimulants oftentimes can exacerbate it, especially over the long term. In the moment, a couple of hours, they may help to kind of key you in, but over the long term, people oftentimes will feel more jittery, more anxiety, and they can also develop dependence. So it's going to be critical to look at things, again, that are synergistic and work in such a way that they're maintaining the body in a multifaceted direction. So looking at this one, splitting into a morning and evening sort of protocol, we can see that ginkgo, very robust support for the memory. So that is going to be helpful first thing in the morning as we're kind of getting prepared for our day, so that we can have those benefits work with us through the day. And then again, over the long term, help to improve that memory. Cordyceps, again, also critical. Cordyceps helps to increase ATP production, and it takes energy to drive all of that neural processing and build those new networks to create those memories and also to retrieve those memories. All of that takes energy. Lion's mane, again, absolutely critical. Neuron growth factor, again, supplementing and supporting that plasticity. So very, very critical. And then as we go into evening, again, we see reishi, which again, GABAergic, helps with sleep, helps with modulating the immune system. Valerian root, again, GABAergic. Magnesium helps to entrain the circadian rhythm. Okay, so all of these things working in multiple different ways across multiple domains to synergistically maximize the potential benefits. Let's take a look at the next slide, please. In this particular example, we're looking at a sort of, a three-part protocol, both morning, noon, and evening. And, morning, a lot of times people feel like they want something that's going to help maximize their focus, maximize their cognition. And again, we're seeing things like, for instance, rhodiola, bacopa. Those are going to increase and improve the overall cerebral blood flow. And that's going to be very, very beneficial when we're trying to maintain maximum focus, especially over the long term. Bacopa also helps with our overall attention, our overall cognitive speed. It is neuroprotective as well. So, excuse me, I'm just going to take a little sip here. I've got some dry air giving me a little frog in my throat. Give me one moment. Can you hear me? Okay. So again, as we were talking about synergistic effects. Now, for instance, I think we talked about lion's mane already. Let's see, creatine in the midday. Creatine absolutely vital for energy buffering. So much of what we need to look at, again, going back to those major domains, is energy metabolism. Creatine is critical for shuttling phosphate groups so that ATP can be rapidly regenerated. And ATP, as I'm sure many of you are aware, is the major kind of, I call it the super high octane go juice that are intensely metabolically active cells like neurons depend on to maintain their cellular metabolism. So without that ATP, everything comes to a halt. So it's absolutely critical that we have that buffer with creatine. And then again, looking at the evening, we've seen kind of a number of these different compounds already. I don't think I've talked about huperzine, but this is, again, very powerful for memory. And huperzine is very interestingly also has activity at the NMDA receptor, and it's an antagonist, so it helps to protect the brain from overstimulation. So a very interesting thing to look at for an evening part of a protocol. Let's take a look at the next slide, please. So what are some of the things that we are seeing as potential blind spots and pitfalls? A lot of times people will say, doc, I tried X, Y, or Z, and I didn't get the result that I was hoping. And I hear that all the time from a lot of different perspectives, whether that's a pharmacological treatment or a supplemental treatment, nutritional treatment, even exercise rehab. And it's very important to keep in mind that a lack of response to treatment doesn't necessarily mean that the data is bad, or that the drug is bad, or that the supplement is bad, or that the exercise was bad. We have to always keep in mind that there's a number of potential unknowns that are completely unforeseeable, that are both biological and physiological, and that may interfere with the body's ability to respond in the anticipated way, whether, again, that's for a pharmacological thing or, in more pertinent to this discussion, supplementation. So we'll take a look at some of the major things that we've been seeing kind of more commonly in the next slide. Getting back, as we had touched on, the sort of confounding of sleep quantity and sleep quality. The one doesn't necessarily equal the other. So it's absolutely crucial that we understand how our patients are sleeping, not just how long they're sleeping. If people are consistently sleeping for a significant duration, which would, say they're getting your standard, 8 hours of sleep, but they're still irritable, they still get, fatigue in the afternoon, they still have decision-making errors, they've got inability to concentrate, obviously they're sleeping plenty, so we have to look at potential other things. And if it's not medications or nutritional, then we have to, and it's not something like, sleep apnea, then we have to start thinking that the sleep architecture itself may be compromised, and that's going to limit the ability for that person to overcome and recover overnight. So if someone is chronically overstressed and constant high levels of cortisol, then that's going to interfere with getting that deep, slow wave sleep, and they're going to have more midnight awakenings. So they are going to have some, compromise of their sleep structure at that particular time in that particular fashion. Again, we talked about the lymphatic system, how critical that is for flushing out waste and allowing the neurons to repair themselves. And then a critical thing to remember is that our cortisol is going to spike in the morning, no matter what. And that's absolutely critical if we have to wake up in the morning, but we have to be aware that that spike is going to come, and therefore we want to make sure that we're modulating the cortisol through the rest of the day so that the cortisol doesn't remain at that very elevated level. So what are some of the things that we can consider when we are faced with this kind of an issue, this kind of a complaint? It may be that we have to change around when someone is getting the supplementation. Just like with a pharmacological treatment, some people respond better to certain medications if they take them at night, and some people respond better if they take them during the day, or at least tolerate them better. A very, very classical example is statin medications. For those who are familiar with those, a lot of the things say take at night, although a lot of the studies were done saying take it in the morning. But the point is, take it once a day. But some people tolerate them much better if they take it at night. So changing the dosing window is something very, very important to consider if somebody isn't responding in the way that we anticipated. And sometimes we have to think about changing the nervous state. And what do I mean by that? I'm sure many of you are aware that we've got an autonomic nervous system, and there are two major phases in that autonomic nervous system: the parasympathetic state and the sympathetic state. If somebody is under constant stress and they're feeling burnout and they're struggling with sleep, then that's going to cause a vicious cycle. And we have to shift that sympathetic system over to the parasympathetic system so that they can fall asleep and stay asleep more readily. So that's a very, very important thing to consider. Another thing that we're seeing very, very commonly and really became sort of, came to the forefront in the sort of social consciousness around times of COVID, and now with long COVID, is neuroinflammation and kind of persistent inflammation, such as after a cold, after flu, and again, going to the case of long COVID, after COVID, in forming long COVID. So looking at ways to modulate that inflammation with something like curcumin can be very, very helpful to help sort of tamp down that overexcited inflammatory response. And then looking at things to kind of help with neuro repair, magnesium glycinate has some very exciting data about that. So one of the ways that we're going to want to change our paradigm is not just looking at how long did somebody sleep, but how can we gauge how well they're sleeping. And one of the best ways to do that is by looking at their next day cognitive performance. Obviously, it'd be great if we could stick everybody in the sleep lab and kind of, watch them constantly, but that's not really feasible. So, a very, very good real world substitute is, what is their next day cognitive performance look like? And if their cognitive performance is improved, it doesn't matter if they slept 6 hours instead of 8, they're still sleeping better. And that's a critical thing to keep in mind. Let's take a look at the next slide, please. In the beginning, we talked about energy metabolism, how critical that is, and how that can be associated with a lot of the complaints that we're seeing. A lot of people, and especially now, are seeing that energy deficiency can be driving a lot of negative cognitive developments, both short-term and long-term. And again, we talked about creatine being critical for that buffering. So if we are in a deficit of actual energy, ATP, in the brain, then it doesn't matter, what kind of, we could have a magic wand, but unless you have the building blocks, that person isn't going to get the response that we're looking for. So if someone's nutrition has been chronically poor, or they simply, for whatever reason, don't eat a lot of red meat, then creatine supplementation is going to be absolutely critical in order to boost that energy buffer and provide that energy resilience in the brain so that it can continue making accurate decisions, even though they didn't sleep well, even though they've had to make 1,000 other decisions that day. That's absolutely critical. And that's going to also support the mitochondria. So it's not just the phosphate buffering, which is critical, but creatine actually stabilizes the mitochondrial folds themselves. So very, very critical to make sure that we are supporting the brain on an energy metabolism basis, not just, providing stimulation, etc. So again, instead of looking at things kind of one-dimensionally, we have to think a little bit multidimensionally, and having a foundational sort of supplementation strategy to make sure that those building blocks are present and are present in abundance is absolutely critical. And creatine is one of the major ways to do that, one of the most important ways to do that. In fact, creatine is so vital to the brain that there's a dedicated transporter that all it does is get creatine into the brain. And without that, we can have a lot of problems. It's called cerebral creatine deficiency syndrome, and it can manifest in a lot of unpleasant ways. So daily creatine supplementation is something to strongly consider, especially if people don't seem to be responding in the way that we would have anticipated based on how we initially built the protocol. We also have an example here, alpha GPC. So alpha GPC, it's an acetylcholine precursor, and that's very, very important. Acetylcholine is one of the major neurotransmitters in the brain, and that can also help to modulate some of the mitochondrial activity. So this sort of feeling of low energy, this kind of mental fatigue, we have to think of it not just as an emotional state, but also as a potential sign of cellular metabolic issues, cellular energy depletion, and overall cellular dysfunction. Let's take a look at the next slide, please. So we had talked again, of a couple of these sort of four major sort of pillars, and a lot of people will say, I try this nootropic and it really was underwhelming. And so why is that potentially the case? So again, it's going to come back to energy metabolism, but it's also going to come back on to inflammation and to modulating stress levels, cortisol levels. So all of these, again, multidimensional, are very, very important. And preparing the body, preparing the nervous system is going to be critical. Again, trying to shift that kind of autonomic state from the sympathetic over to the parasympathetic is going to be absolutely vital. And if someone is constantly in that sympathetic state, other things that they can be having is, a sort of numb emotional response. And one of the things that we will see is, again, they're not having the response that we'd have anticipated to something that's generally considered to be a sort of stimulating neurotropic like Bacopa. So if we're seeing that kind of a blunted response, then we also have to think about, what? Do I have to look at cortisol? Do I have to look at switching over the autonomic state from a sort of a primarily sympathetic autonomic drive to a parasympathetic autonomic drive? So we want to, again, look at things that are going to really regulate the cortisol levels. We want to look at things that are going to, enhance neuroprotection. And we want to look at things that are going to help sort of calm the brain down that are GABAergic, like ashwagandha. So, very, very important. And then neurotransmitter, neurotransmitter control. Again, rodeo also modulates, dopamine, serotonin, and other monoamines through MAO modulation. So absolutely critical to consider all of those different factors and to look at ways that we can pair the adaptogens with the neurotropics so that we can maximize the synergistic benefit. Let's take a look at the next slide, please. So, the key takeaway that we sort of touched on when we started. If a protocol fails, it doesn't mean that we did a lousy job and we used bad data and that it's a bad product or it's a it's a you know, an impure product or what have you, a lot of times the protocol is not working, not because of anything that's an issue with the compounds themselves, but because somebody's physiological state hasn't been primed to maximize the potential benefits. So we want to look at the system timing. We want to look at their energy status. We want to look at what their autonomic status is. Are they in the parasympathetic drive they want them to be, or are they in kind of an autonomic fight or flight overdrive? Are they getting adequate sleep architecture, not just the sleep duration? So all of these things, we have to think about them. We have to keep them in mind as we build these protocols, because without them, even the most perfectly tailored protocol with the best possible sourcing, the purest, highest concentration extract, is not going to give them meaningful benefit if their body isn't primed to utilize those building blocks. Next slide, please. So let's quickly touch on, again, some of the things we had talked about a little bit more in depth. Again, energy deficits, brain energy, absolutely critical. ATP metabolism, again, is going to cause mood issues, memory problems, errors in decision making, amotivational syndrome. All of these things can be looked at as an energy deficit problem, an energy buffering problem. So a lot of times that's some of the first things we'll see. It's like, geez, I started making mistakes that I would never normally make. And you may say that in a colleague, you may see that in yourself, or that may be a complaint. I hear it not uncommonly. Gee, doc, my boss noticed that I was making these mistakes that I never made before, or my husband has started doing, acting X, Y, or Z, which he never did before. So a lot of these very, very subtle changes can be clues that the metabolic activity, the ATP activity, isn't quite right. So very, very important to take a very careful assessment and keep it in the back of our minds that energy disruption, energy metabolism is a critical component of our overall functional well-being. Another one, we touched on lymphatics and sleep quality. Without that appropriate sleep architecture, without that deep, slow wave sleep, that lymphatic system is not going to be able to do its job. When we're in slow wave sleep, the neurons, they actually shrink a little bit and they pulse a little bit. And it's that shrinking and that pulsation that actually pumps the fluid through the brain and allows for those waste products and those toxins to be removed from the brain. So that's going to be, critical to our circadian rhythms. That's a part of it. That's going to be major for our neuroinflammation. Without clearing out those wastes, we're going to have our brain in a pro-inflammatory state, even if the rest of our body is in, an anti-inflammatory state. So absolutely critical to understand the systems and how they work together. And that ties in, again, to neuroinflammation, which oftentimes exists, as I just mentioned, without concomitant inflammation in the body. You check the CRP, you check the ESR, that's all totally normal. That doesn't mean that what's going on in their brain is normal. And that's, very often seen. I see it all the time dealing with toxic metabolic encephalopathies. Doc, how can it be, this drug, we check the level's negligent. Just because the level's negligent in the blood doesn't mean that it's negligent in the CSF or in the brain. If you, do a metabolite in the CSF, you're surprised. So very, very important to keep in mind that the serum level, what we're seeing in the body, isn't necessarily what's going on in the brain, because they're distinct compartments. So, we talked a little bit earlier about the brain-gut axis. That brain-gut axis actually changes the permeability of the blood-brain barrier. So if the GI tract is not happy, let's just use that word, it's not in its prime condition, that subtle inflammatory exchange can actually cause neuroinflammation as well. And that's going to increase the oxidative stress. That's going to deplete ATP. That's going to interfere with neurotransmitter synthesis. And they're going to have mood issues, cognitive issues, and attention issues. So very, very critical to keep all of those different things in mind. And, this last line I just talked about, we have to think multidimensionally and we have to think synergistically. Let's take a look at the next slide, please. . very, very important. Today's patients are the most sophisticated and educated probably in history. But, and that's great, but, and there's a big but, sometimes that can be a detriment to forging the team, because a lot of times people don't understand what exactly they don't know. So now that people have kind of had this mass exposure to all these hacks, all of these different compounds, these really, really big kind of super stacks of different nutritional supplements, we want to be able to provide them the guidance that allows us to streamline all of that into a targeted, tailored, and repeatable therapy that can be maintained over the long term. So we have to use our knowledge, which is going to be, even more sophisticated, even more in depth than what they're getting, obviously, because we spent a lot of years doing it, and look at how is this going to interact with their circadian rhythm? How is this going to interact with their emotional status? How is this going to interact with their autonomic status? How is this going to interact with their emotions, their cognition? And working that all together into a streamlined protocol that's going to go after multiple modalities synergistically, rather than becoming fixated on a single symptom, such as, hey doc, I can't sleep long enough. So we also have to think about, if they're not sleeping well, that explains why their mood is off. That explains why they're making errors in their decision making. That explains why their short-term memory is off. That explains why their recall is off. So all of these things are interlinked, and we have to think about things as a network and not as a single problem with a single solution. Next slide, please. And that brings me to why we created SensIQ. As I had mentioned at the beginning, I'm very proud to be one of the co-founders, and I'm also the chief medical officer, in addition to my day job as a board-certified neurologist, working, in my passion of acutely and critically ill neurological patients. And we saw this problem getting bigger and bigger and bigger and bigger, and that is that there's more and more data, which is great, but now we have the problem of the needle in the haystack and sorting through, all of the stuff, all of the fluff to get the real gems. And it can be overwhelming. It can be daunting, even for extremely sophisticated and extremely seasoned practitioners, let alone, the people that come to us for help. And we realized that we need to create something that's going to allow for a really structured, targeted, data-based supplementation regimen that is also going to be very, very highly synergistic, and looking at multi-domain, multifactorial solutions to multi-domain, multifactorial problems. So we focus on transparency, we focus on synergy, and we focus on a quality control that's so tight that the practitioner can actually have that discussion with their patients and actually titrate the dose depending on how the patient's responding. Next slide, please. Just going back to the three sample protocols that we looked at earlier in the slide, those are actually things that we've created. We utilize those very same ingredients in appropriate doses in our steady mood and memory, our clear mind reset, and our restful night system. So those very, very, highly tailored, highly synergistic, and relatively complex protocols have been kind of streamlined and built into these very, very easy to utilize, easy to manage systems with very, very minimal supplement burden, so that adherence can be improved.